Hello, my name is Joy Gonzalez Aurora and my topic is immune system. The immune system protects the body from possible harmful substances by recognizing and responding to antigens. The immune system recognizes and destroys substances that contain antigens. Antigens are substances, usually proteins, on the surface of cells, viruses, fungi, or bacteria. Non-living substances such as toxins, chemicals, drugs, and foreign particles can also be antigens. Your body cells have proteins that are antigens. These include a group of antigens called HLA antigens. Your immune system learns to see these antigens and normal immune cell does not react against them. An immune response types is innate immunity and acquired immunity and passive immunity.
Human immune system is the best doctor in the world. The immune system works 24 hours a day to protect us from enemy invaders. The bone marrow and the thymus are our main lymphoid organs. The bone marrow creates red and white blood cells. White blood cells are our immune cells. Like an army trains its infantry, air force, and navy, our thymus trains immune cells called T cells to perform specific functions. The immune system also consists of peripheral lymphoid organs like the tonsils, spleen, lymph nodes, and appendix. For example, swollen lymph nodes under the arms show that our immune cells are fighting an infection. Now, let us look at our very protective immune cells. B cells are immune cells that shoot specific missiles at invaders. These missiles are called antibodies or immunoglobulins.
An acquired immunity.
Stimulation of adaptive immunity. Fungi breach anatomical barriers to gain access to internal structures. Dendritic cells recognize and bind to fungi and fungal particles by pattern recognition receptors. Fungi and fungal particles are ingested by dendritic cells. Dendritic cells migrate to lymphoid tissues, including regional lymph nodes. Dendritic cells migrate to lymphoid organs to stimulate adaptive antifungal responses. Within lymphoid organs, dendritic cells activate adaptive responses. CD4 T cells are stimulated to differentiate to Th1 and Th2 cells. Th1 responses favor activation of macrophages, B lymphocytes, CD8 T lymphocytes, natural killer cells, and neutrophils. Th2 responses favor activation of B cells, eosinophilia, and IgE production. T cells are recruited to the site of infection. Attaining an appropriate balance between Th1 and Th2 responses is thought to be important for achieving optimal antifungal protection while limiting autoimmune injury.
And applications in medicine. Autoimmune disease arises from an abnormal immune response of the body against substances and tissues normally present in the body. This may be restricted to certain organs. In autoimmune thyroiditis or involves a particular tissue in different places, e.g. gut bacteria disease, which may affect the basement membrane in both the lung and the kidney.
What are autoimmune diseases? There are more than 80 diseases stemming from autoimmunity. Autoimmunity is caused when cells in the body identify healthy cells as foreign and attack them. 1 in 5 Americans suffer from autoimmune diseases.
My family's experience with autoimmune disease began when my sister became ill suddenly one day. She basically just couldn't get out of bed. And she was this healthy 19-year-old girl who had never been sick a day in her life. And we took her to our family doctor, who kept telling us repeatedly, she just has a virus, she's going to be fine. But her body was crashing. And it was just incredible to me that she could be seen by 7 or 8 doctors. And they all have medical degrees. They have no idea what they're looking at.
It took them 12 years to figure out I had multiple sclerosis. 12 years of miscarriages, 12 years of needless surgery, 12 years of complete battling hopelessness.
Are you or a member of your family at risk for developing autoimmune disease? Women are 75% more likely than men to develop an autoimmune disease. Men get autoimmune diseases too, and when they do occur, the diseases tend to be more severe in men than in women. Autoimmune diseases tend to cluster in families. This means that if your grandfather suffered from rheumatoid arthritis and your mother type 1 diabetes, you could be at increased risk for developing autoimmune disease. Support the American Autoimmune-Related Diseases Association today. Help us advance work in autoimmune disease research, awareness, and education.
An example of autoimmune disease is Sjögren syndrome.
In this video, I'll be discussing about what Sjögren's syndrome is, who it affects, and what can be done about it. Sjögren's syndrome is a chronic autoimmune disease that affects mostly women. 90% of those affected by Sjögren's are women that tend to be middle-aged. It is characterized by dry eyes, dry mouth, dry membranes. Occasionally, it can affect the kidney, the blood vessels, the central nervous system, or cause severe arthritis. Sjögren's syndrome can be primary or secondary to another autoimmune disease. The diagnosis starts with listening to the patient's complaint of dryness of the eyes and the mouth and inability to swallow food. The common tests used to evaluate Sjögren's syndrome are done by the ophthalmologist, and that would be a Schirmer's test. The Schirmer's test measures the amount of tears one produces, or by an EMT and a maxillofacial evaluation. Diagnosing Sjögren relies on criteria. The treatment has 2 aspects to it, the symptomatic relief and the systemic treatment. The symptomatic relief for the eye includes artificial tears, cyclosporin, eye drops, and plugging of the tear ducts. For the mouth, the first we do would be advise patients to take small sips of water, sugar-free gum or candy, in order to increase their salivary flow. If these fail, medication that stimulates salivary flow can be used. What are the systemic treatments that address the immune abnormality associated with Sjögren's syndrome? They are Plaquenil, hydroxychloroquine, and steroids. Thanks for watching. To learn more, please visit
In Sjögren syndrome is pros and cons. In pros, in general patients with primary Sjögren syndrome, prognosis is good. In cons, most patients suffer from dry eyes and mouth-pharyngitis. Other patients might theory disease, liver and kidney and liver. Occasionally, some patients develop symptoms of rheumatic disease, such as lupus or rheumatoid arthritis. An issue applied in Ecuador diagnostic. For molecular dry eyes, there are 2 methods with which you can determine Schirmer test, which measures the amount of liquid given off over a period of 5 minutes. You immediately stand fine and is a strong indication of dry eye. For molecular dryness of mouth, usually a biopsy of the salivary gland.
go to the
Thanks for your attention.